Diabetes, a doctor's dreams video. A few months ago I noticed that I was urinating more than usual and losing weight. Although healthy and trim and basically eating well, I had come down with diabetes. Maybe that shouldn't have been such a surprise, as diabetes certainly ran in my family. My father had diabetes and both my older brothers have diabetes. Diabetes is a scary diagnosis. It's the #1 cause of kidney failure, lower limb amputations, and adult blindness, as well as well known to shorten a person's lifespan. Although I didn't have other symptoms, there are several others that many people have, such as blurred vision, excessive thirst, abdominal pain, and persistent hunger. Diabetes affects 37 million Americans, and of these, 1 in 5 don't even know they have it. The number of people diagnosed with diabetes has doubled in the past 20 years. Our bodies carefully regulate the level of sugar in our body through a small protein called insulin. When we eat, our sugar levels go up, and our pancreas pushes out insulin into our system. That helps our body cells absorb the sugar to places we need it, into our brain or our muscles, or sometimes into fat for storage for later use. Man, like 96 million other Americans, I've been told I was pre-diabetic. My blood sugars on several tests over the years were just a little bit elevated. Instead of the normal level of below 100, I'd often range in the 110, 120, even as much as 130 levels. There are two main types of diabetes. Type 1 is when the pancreas stops making any insulin. For that, a person would need shots. I have type 2, in which I make insulin, like 90% of people have diabetes, but my body isn't responding well enough to it. There are many types of medications that can help people with diabetes. I take metformin, and that's a pill. I just take 2 pills once a day. Most people end up taking 2 pills 2 times a day. But there are also shots that are very effective. You can take a shot once a week, and it will help regulate your diabetes quite effectively. The biggest changes I made in my lifestyle was to cut out the sugar that I was eating. Oh, I missed the chocolates and the candies and the soft drinks. I don't really miss them that much. I guess the main thing I miss is my chocolate milk. I loved my chocolate milk. But it was worth it. I checked my sugar, my glucose monitoring kit, and my sugars always run around 110 now. I feel good, and I look forward to having a long and healthy life. So this is how I test my sugar. I have it in a little kit. It comes in a little black bag like this, and it consists basically of 3 parts. It's got the meter, it's got the strips, and it's got the puncture. So first thing we have to do is we have to put in a new needle. So we take out the old needle and put it in a safe package so we don't stick ourselves or anybody else. We take out a new puncture needle. These are good for about 5 punctures or so. Twist off the protecting tip, and there's the needle. And here's the test strips, and you can get these machines for practically nothing. They give you refund on the meters because they make all the money off the strips. The strip has a little electronic doodad on it. Right, and then you put it into the slot on the meter, and the meter activates. Okay, so it says it's ready, it's got the drop. So I'm going to take this piece now. You want to back up a bit, and you cock it like that, and hold it next to one of your fingers. You want to have the sides, that's where the blood is. It can be any finger you want, of course. Tiny little thing, and then you can see the little blood drop. See the blood drop? So you put that little slot next to the blood drop, comes right up in there. It takes a few seconds. And gives my reading, 102. It's a very good reading. You take this out and record the number. Put everything away. And we are done. That's my sugar. 102 this morning. That's a good number. This is Dr. Philip Levin with short medical videos. Please subscribe to my videos and perhaps check out my books on my website.